All right. Hi, everybody. Thanks so much for coming to our webinar today. We are doing Living Well with Parkinson's Disease. And we'll go ahead and go here. I'm Kelsey. I'm an occupational therapist here at Renew Physical Therapy in Bridgeport.
And I'm Nicole. I am the physical therapist here in Bridgeport, and Kelsey and I together work with our neurological injuries here.
I, as an occupational therapist in this setting, specialize quite a bit on the upper extremities, kind of waist up with the core, arms, chest, back, things like that. Where Nicole?
I work more lower extremities, more big movements, like your sit to stands, your walking, your mobility in general. And then we also focus on any orthopedic issues that you may experience along the way, like a sore back or a bad knee, things like that.
Yeah, so we work together as a team to try to treat the whole body. That being said, we're going to move on to a little bit of background about Parkinson's.
So just some background. Worldwide, we have about 10 million cases of Parkinson's. That has increased quite a bit over the past 3 or 4 years with no real known reason at this time. Typical age of onset is between age 55 and 65. And actually they are starting to have more earlier onset diagnosis too, again, without any unknown reason. 90% of cases are of an unknown cause, where 10% are hereditary, so passed from family members. And it is 1.5 more times in men as compared to women.
So we here in Michigan live in what's called a Parkinson's belt. And as you can see kind of the hot areas that are more of those red, orange colored sections, going down to yellow, and then green being the less number of cases in those areas. What we found is that it's in more urban than rural. And Parkinson's is now the second most common neurodegenerative disease, and that has increased in the past couple of years. It used to be the third, I think, or fourth.
So now it is second to dementia and Alzheimer's.
Yeah. So again, here in the Northeast and Midwest is where it's most common. We're 2 to 10 times higher than in those southern and western regions. And then it is more common in Caucasian than it is for people African Americans or Asian descent. So that's a little bit of kind of that, population that it most impacts.
So with Parkinson's, there comes a lot of varying symptoms from person to person. There is the common resting tremor when you're sitting at rest, and you may know someone have a hand that kind of likes to rattle, or maybe a foot that shakes. Some people have more of the head shake, but that resting tremor is kind of one of the basic signs of Parkinson's. And then there is bradykinesia, which is just a fancy word for small movements. The area of the brain where Parkinson's is affects our ability to know how far and how big we're moving. So bradykinesia is that shrinking of our movements. Rigidity is another very common symptom. A lot of our patients with Parkinson's will complain of stiffness, especially in their spine and in their hips. So a lot of the warm up leading into doing our exercises and therapy is getting you loose and mobile before we start doing our movements. Micrographia, which is tiny handwriting.
Yep. Which is an early, actually, warning sign of Parkinson's, something that we see develop first, or one of the few things in certain cases, and in many cases, I should say, but it is different for everybody how, you experience your symptoms of Parkinson's. So
another sign of Parkinson's can be the hallmark, like shuffling your feet, taking short, choppy steps, or just impaired balance and losing your balance often. there's two types of Parkinson's that they've kind of labeled, and it's the tremor dominant, or they call it a Parkinson's instability and gait disorder type of Parkinson's. So you can go one of two ways. And incoordination and just balance comes along with Parkinson's as well. You know, with the shrinking of your movements, with the shuffling of feet, with your loss of balance, there also comes your risk of falls. One of the other symptoms is freezing of gait. So, for example, walk through a doorway and all of a sudden you freeze and you feel like you can't make it through that doorway, almost like you're stuck in one position. And there are some exercises and movements that we can do to try to help you through that. And since there is a unilateral onset, so what that means is you might see symptoms more dominant on one side of the body, a tremor on one side, weakness or stiffness more to one side compared to the other.
And I think with the falling and incoordination and that impaired balance, something that Nicole hits on really well is that those reactions to that then. So, you know, taking those steps to the side or whatever direction it is that you're kind of losing your balance. It's just an area in PT that Nicole does a fantastic job hitting on, and that's that impaired balance reaction. So making sure that we are not falling, you're catching yourself and being able to, you know, right yourself. So
we like to call that reactive balance. It's your ability to react in a moment and catch yourself.
Yeah.
So
with Parkinson's, there's also non-motor symptoms. And there's a kind of wide variety of these. The first one here on our list is orthostatic hypotension. So that is where we change in position. So going from sitting to standing or laying to sitting, and you have a drop in your blood pressure, and then we'll kind of get this dizzy feeling, you know, your lightheadedness, and that's more common. We also have excessive sweating, which, you know, kind of, again, these symptoms occur in different ways for different people. So that's not always a common symptom.
So Parkinson's is actually shown to affect one of our neurological systems that regulates our body's fight or flight response. So just like with Parkinson's, our reactions might not be normal. Parkinson's can also affect our ability of our body to regulate itself, which is why you get the orthostatic hypotension, the ability for your blood pressure to not react as normally, and even the excessive sweating. That's all a neurological response to help us control our, you know, happy mediums. So a lot of things can be affected by this.
Absolutely. Jumping down to the bottom of this list here, we also have voice changes. What we'll find with this is where people start to talk in a really quiet tone, not really amplifying their voice. So that's something that we hit on in our sessions as well to try to combat that. Because what you'll often hear is, you know, people saying, yeah, my spouse says they can't hear what I'm saying. They need to get their ears checked. Well, it's just that quiet tone. You don't necessarily notice that you even have that quiet tone. It's just kind of a common symptom. Next, we've got apathy, which goes along with anxiety and depression. So this is your ability to kind of enjoy those things. We get into a depressive state where we lose that joy of different activities. And with that comes kind of the loss of leisure activities, sometimes some social participation, which aren't necessarily symptoms, but it's that depression is what's causing that loss of apathy, and increased anxiety causes that as well. Along with cognition. So cognition is a really broad term, but what we are talking about here is individuals having forgetfulness, distractibility, or kind of that weakening of executive function skills, where we have impaired problem solving, planning, multitasking, and all of those are affected. And what we usually see is kind of like the forgetfulness or being unable to like work your way through something, is where you'll see that kind of impaired executive function, where it's like, I know the task, but I can't get through it. And we work on that in occupational therapy throughout your session in different ways. But then we also have the slower mental processing, where we have, an inability or a hindrance to learn new information, as well as recalling previous information like names or dates or, memory with your families, things like that. It's harder to recall those, and it's because of that slower mental processing. We also see, again, that these present different everybody. So it's not necessarily that cognition, you may not have all of these, but you might have a select few. Like, yeah, my problem solving is great, but I can't remember, what I had for breakfast yesterday. That's things that we can work on throughout therapy, and we try to focus on within our treatment.
One of the cognition things that I seem to notice is dual tasking. So a lot of times with Parkinson's, people are like, I can walk and that's fine. Or someone can say, I can sit and talk to someone. But if I were to walk and talk, I'm a big fall risk. And so we like to work on doing dual tasks. So two things at once. And that's one thing that Kelsey and I both work on doing in our sessions. So dual tasking is very important.
It is, yes. It can be challenging, so.
So how can physical therapy help? So overall, when I come in and I meet you on that first day, we assess kind of all of your symptoms and kind of look to see where your weaknesses are, and what things we can improve upon. Generally with Parkinson's, there's 4 things we kind of really focus on. Your posture is one of them. With Parkinson's, that tends to want to pull us forward. We want to be hunched forward. And that just pulls our center of gravity and our balance forward, and that can lead to landing forward on our face. So we work on a lot of our postural muscles, so our back muscles, our glutes, just to be able to help us be up nice and tall and have a good center of gravity. One of the other things I look at is like joint stiffness. Do your hips move good? Because if your hips don't move good, you're not going to be able to react and catch your balance. Do your ankles move good? We have to have good ankle mobility to be able to kind of stabilize ourselves when we're standing still. So we look at rigidity. Another thing we look at is the size of your movements. Like I talked about before, that bradykinesia, we move smaller. So I look at and how big your steps are. Do you swing your arms? Do you just have little small movements, or are you comfortable reaching to grab something out of your base of support? And then one of the other things that we look at is your ability to shift your weight from side to side, because that can be an indicator if you are someone who likes to freeze with your gait. Another thing that I like to check when you come in for your evaluation is your balance, your ability to stand in balance, but also what we call your dynamic balance. So your balance when you're moving, when you're walking, and your ability to catch yourself if I were to pull or push you just out of nowhere, and for your ability to react and catch yourself. A lot of people with Parkinson's have issues with reactive balance, and just doing therapy to focus on that can really help reduce your fall risk and your chance of injury. Typically with physical therapy, we focus on 2 kind of major treatment protocols or ideas. If you've had Parkinson's and been around for a while, you've probably heard of LSVT big, which is a protocol that consists of, 6 specific movements, and then 5 functional movements like sit to stands, reaching, and kind of working on big amplitude and stiffness. And then there's a newer protocol called POWER, which stands for Parkinson's Wellness Recovery. And that is something that can be worked into a session and can be done in sitting, standing, even laying on the mat table. So it's good for anyone along their Parkinson's, from early on being able to do a lot of things to even when are feeling less mobile or more stiff. So all these treatments are flexible and can be tailored to you. Usually figure out what's best for you based on your evaluation. And then my favorite is just functional movement training. Usually people have difficulty getting up and down from chairs or in and out of bed or in and out of the vehicle, and even on and off the floor. And working on that in therapy can really give you a sense of freedom and independence. And so that's one of my favorite things to work on. So.
And LSVT big and power are also kind of based in those functional movements, but they're more regimented.
Yes.
So they kind of, those two different protocols and that functional movement training all focus on the same things, which is keeping you moving, keeping you active, keeping you physically strong, which is great.
Yeah.
And those are things we do every day, sit to stand, you know, getting in and out of bed, all the stuff that we want to maintain our independence in. So.
Exactly.
So for OT, a brief little overview of OT is going to be improving your skills so you can improve your independence in your activities of daily living. So what's an activity of daily living? That's going to be getting dressed, bathing yourself, transferring in and out of bed or in and out of a chair, feeding yourself, all of those skills. And then we have our instrumental activities of daily living, which is going to be like tending to your home or to your pets or your family. So the way that OT does this and allows you to maintain your independence in those tasks is through improving your fine motor coordination, your gross motor coordination, your strength, range of motion, endurance, all those things, because those are what we need to be able to keep on kind of performing the way that we need to. And the way that we do that in therapy is through various activities. I like to say, you know, OT is here for fun. We're gonna play some games, and we're gonna have different activities where we're interacting, where you are working on those necessary skills. But not necessarily, I'm not going to make you cut up a steak here, but we're going to work on the skills that allow you to do that. So I like to, you know, kind of have a good time and enjoy ourselves while working on those crucial skills to maintain your independence. OTs can also make some suggestions to your environment and within your home, how you're functioning. So whether that's the height of your bed or the distance you are from a grab bar or the placement of grab bars, those are all important different modifications that we can make and suggestions we can make through, you know, interview and problem solving, where we see you are having issues in your home and what modifications could be made to those, as well as activity modifications. So I know standing and doing the dishes can be exhausting sometimes. So is there a way that we can, you know, modify that task so you're able to complete it without total fatigue? Or, you know, the whole bathing routine, maybe that is such a long, lengthy process. So maybe it's more of a suggestion of what time of day we're doing it. So we're doing it when we have the energy to complete it well and safe. So those are some different examples of modifications, activity modifications, and suggestions that could be made for you in your home or your life, just depending on what, you know, kind of challenges you're facing.
Or even just different adaptive equipment, things to help you get shoes and socks on and off, different plates or eating utensils that might make eating easier. Sometimes those movements with a tremor can be a little more difficult, so they have weighted spoons, they have plates with edges. There's just a lot of different things that can be recommended just by watching you move and do things.
Absolutely. Yeah. Lots of different adaptive equipment. Nicole's absolutely right. That would help with things such as tremors, or just those kind of not as fluid motions, I should say. And those are great examples of different adaptive equipment. We definitely can work through and problem solve and see what's the best option for you. The next thing in OT treatment would be the cognitive aspect and how we work on that throughout our sessions. So with delayed recall, it may be as simple as, you know, giving you a list of words to remember over a span of 5 minutes while we do a different task, and then helping you kind of recall those words through different cueing and how we're able to do that, you know, in our brain and cue ourselves in the future. As well as executive function, which is going to be that problem solving. With that, you know, we are able to do that through different games and activities, make more of a fun task and not so much of the work of working on that problem solving. that attention and concentration, they go together, and that's kind of that dual tasking that we work on while we're having you do, some different physical activity, having that cognitive aspect that's added in, where maybe we're listing off items within a certain group or working on that language fluency of being able to recall those different categories and whatnot. So lots of different ways that we can incorporate that into your session. And the way that we kind of
Schedule. Or
the way that we kind of decide to work on it, I guess I was looking for a more technical term, I suppose, but the way that we kind of determine what needs to be worked on with that cognition is through assessment. So we have a specific assessment. It's called the MOCA that we use here. I use to see where your problem areas are, because we might not need to work on everything. And that's great, because if we can rule some things out, that allows us to prioritize what needs to be worked on. And along with that, we do our cognitive assessment during OT, as well as assessing the strength in your arms, your grip strength, shoulders, elbow, all the way down. So that kind of goes for that fine motor coordination, gross motor coordination, strength, range of motion, all of the above.
all right, so daily goals to work on when you have Parkinson's. Obviously, Parkinson's is not something that goes away overnight. It's something that you have to work at to help maintain your function. And all the research out there says that if you work at it and you participate in therapy, you do exercise, that all of these strengthening and cardiovascular activities can actually help slow your progression, which is huge. So that means that physical therapy and occupational therapy can actually make a difference in your quality of life. And with that comes just some simple things that you can do on a daily basis. So one of our recommendations is that you're doing 15 to 20 minutes of amplitude movement. So this means it has to be intentional. It has to require effort. You have to be working, but it's only 15 to 20 minutes, which is not a lot. You can do that. And we can show you the exercises and different movements to do to kind of help keep you where you need to be. On top of that amplitude movement and exercise, we also recommend daily cognitive exercises. And that's where Kelsey comes in to kind of help find where there's some areas that might be a little bit weaker, and to give you, some examples of things you could be doing at home, like maybe doing a Sudoku puzzle, or maybe playing some card games with your significant other. Another thing that we recommend is also 20 minutes of cardiovascular exercise. So that could be walking, that could be riding a bike, that could be doing a boxing activity, it could be doing, some cardio Pilates, something that you enjoy, which is important, and feel safe doing. Just 20 minutes 3 times a week, because getting that extra blood flow to your brain is so important for people with Parkinson's. So all in all, we're asking for maybe an hour, 3 days a week, and maybe a half hour the rest of the time. So these are just some daily things that could help manage and improve symptoms.
And what we like to say too, a great way to implement this is to kind of build yourself a schedule. Maybe this isn't after lunchtime. Maybe you feel your best in the morning after breakfast, and that's when you want to do these. But getting it done in a time frame that works for you on that daily basis is really important. And I think keeping to that schedule is what kind of keeps us going, because otherwise it can be like, oh shoot, it's 5 o'clock now and I forgot to do my exercises. Now I'm kind of tired, it's after dinner. Well,
yeah,
having a schedule allows you to kind of keep up with that and not get into that habit of like, oh, too late now, maybe tomorrow. So
another thing with having, on top of having a schedule, it's good to have someone to hold you accountable. And that's where significant others kind of come into play, or even just having a friend or a loved one, your child, just checking in and say, hey, did you work out today? You better get at it. Remember your schedule. And just having someone to hold you accountable and encourage you along the way.
Yeah, absolutely. Because it's so important for us to take our own healthcare into our own hands, but having someone to provide you some of that support as well and keep you going is really important. So finding that person, that loved one, caregiver, friend, whoever it is, to, kind of provide that little extra support is always helpful.
Yep.
So we like to think of therapy as being part of a team, and there are other people part of that team. Your doctor is one. We go see that doctor for those checkups, and that's checking in with your therapy team as well. Maybe you come to therapy and you make some fantastic improvements, and we say, okay, well, you're doing good. You get to get out of here, skedaddle, keep up with your home exercise program, but we'd like you to check in with us every once in a while and say, hey, maybe I'll come in for a screening to see how I'm doing. And then we'll be able to assess that, because we're able to pick up on those little nuances of what we see, improving, or if there is a small decline.
Sometimes just doing a quick walking screen and watching you move through the clinic, and then, having a conversation where we can hear your voice and see if that's gotten softer, and maybe even just watching your handwriting to see if that's changed from, 6 months to a year ago is enough for us to be like, George, it might be time to get back into another round of therapy and just make sure we're doing good. Or even just to update your exercises. Maybe you might need something more challenging.
Yeah. And with that, the reason that we have these, or we recommend that people come in for these frequent, yearly or every 6 months kind of check-ins, is so we don't have too drastic of a decline that now we're working even harder than we were before. No, let's just keep up with a good schedule, keeping the whole therapy team in a loop, and that includes you. And keeping up with managing all those symptoms, because being proactive is what is going to slow your progression of Parkinson's.
Yeah. Our overall goal in therapy is to keep you as independent and functional as possible. And so just regular interaction and communication with us and with your doctors is the best way to do that. And movement is medicine. So that's a big thing to remember when it comes to Parkinson's, because may lose the motivation. You just might feel more comfortable sitting in your chair than listen to me or Kelsey say, oh, stand up taller, oh, take bigger steps, oh, move that arm better. But, in the end, it keeps you moving longer and better and maintaining a good quality of life.
Yeah. And I think it's fair to say that our patients who we see now with Parkinson's always leave here saying, I feel better than when I came in, because that getting up and moving and getting that blood flowing is so important for our bodies, for our brains. It just makes a huge difference. And therapy is a safe place to get up and move and to challenge yourself, to make those improvements. Yep. So, okay, we've come to the end here, but it looks like, do we have any questions?
We do have a couple great questions.
Okay.
The first one that's from somebody who's here on the call with us. Ask if you can expand upon what you mean by masked face when it comes to Parkinson's disease.
Sure. I'm going to scroll back up to that slide for you, Nicole. Expand on that.
Masked face.
Yeah. So that's where we have.
Oh, I see on the. I don't remember saying that, so I see it on the slide there.
Yep.
So our facial features are just like our muscles. So as we lose the ability to perform bigger movements, like Parkinson's effects, it can also affect our facial features. And you might notice that someone with Parkinson's might not smile as big. They might not have as many reactions with their facial expressions throughout the day when you're having a conversation with them. So all those facial muscles are also affected. So the masked face is just kind of just a more
muted facial expression,
neutral face, as if someone were, just focusing on something and not really reacting.
And that goes through conversation too. You'll see that in conversation. I know I have like very expressive eyebrows, right? So when I'm kind of passionately talking about something, my whole face is moving and lighting up, but you may not see that as dramatic of those reactions, or maybe even at all with that masked face. That's a great question.
Yeah. And actually that's something that we sometimes work into our sessions. If we see someone doesn't really utilize a lot of their facial expressions, and they don't smile as big, we work that every time you stand up, you got to smile, or you got to show me your scared face, or,
Right.
Just working on those facial expressions can be helpful.
All those little muscles in there, they get the workout too.
Yep.
Yeah. Good question.
Great. Thank you for that. And we had another one. She said, I'm a 70-year-old female. Thank you for this seminar. And she said she has a tremor when she writes, but her writing has not gotten smaller. So just curious how you kind of tackle those writing things and something you might suggest she try.
Sure. So in occupational therapy, what we can do to kind of inhibit that is sometimes we'll add weight and work on, like a wrist weight to the arm and work on writing through those tremors. I do like a lot of breath work as well, because sometimes that can help kind of decrease our tremors, which tremors obviously impact our writing in general drastically, but we do that through different practices kind of throughout our session, with, like I said, some weighted things, some breath work, and kind of working on those same motions, those basic kind of what I would call like pre-writing skills, kind of going back to the pre-writing and focusing on that fluidity of your movements and working through those tremors that way. So that's how OT focuses on that.
And sometimes even with a tremor that may be down in your hand, Parkinson's is known to affect our core before we start getting to the extremity weakness. So we usually assess your strength also in your shoulder and your shoulder complex. So there could be some weaknesses in that area too, that just strengthening there can give you some more stability down in your hand.
Absolutely. Yeah. Treating the whole extremity is a great way to provide more stability. Absolutely. Yeah.
That's great. That's very helpful. I did have somebody just ask about the slide that has the map on it. I don't know exactly what the question was, but can you go over again the 2 to 10 times higher in the Northeast and Midwest?
Yes. So there is a higher like
Frequency
amount of cases
Per capita.
Yeah, in the Northeast and Midwest than there is in the southern and western regions of the United States. And that's really just like the verbal representation of that map. So the map is showing you that statement where you see those darker orange and red areas kind of in that upper right area and down through partway through the United States, where over to the left, we have a lot more of those green regions. That's what that's saying, is it's more common in this Midwest than it is in the southern region.
I say overall too, there's more major cities in that Midwest, Northeast region. So that kind of contributes to why there's more red areas there.
Yes.
As opposed to the other side of the US.
Which goes in that urban,
Yeah.
more prevalent in urban than rural places. Yeah.
I mean, overall, this is just looking at the US, but Parkinson's is more common in like northern countries. If you go over to like Northern Europe, you'll see these same kind of colors and demographics.
Yeah.
Okay,
Good
that's
question.
helpful. Thank you. She said that makes sense. We did have a question from somebody that said they have lower back pain, and I'm not sure if that's generally related to Parkinson's or if that might be something else they have going on. So just wondered if you had any thoughts on lower back pain.
So lower back pain can be a common complaint with Parkinson's. It's not really a diagnostic, like, oh, you have back pain, you could have Parkinson's. It's more of a side effect of Parkinson's. You might not move as well. You might tend to sit more often, and that can contribute to some back stiffness and pain. During an evaluation on that first day, we talk about your Parkinson's symptoms, but we also talk about what other issues you may have going on. Do you have arthritis in your hip? Do you have a history of back pain? Do you have a history of neck pain? And those are all things we consider when we're making a plan. We do also have some patients that don't come for their Parkinson's, but they may actually come for back pain. So, treatment may be more consistent with focusing on treating your back symptoms. And then we include some of the amplitude movements and dual tasking in with your treatment. After an evaluation, we really work on making a plan that's kind of specific to you and your needs.
Yeah, because it's hard to say, the cause of your back pain, but Nicole's absolutely right. The way that we treat it is through that motion, that strengthening, and decreasing tension. So yeah, definitely, come on in and see if we can help you out with that. And whether or not it is Parkinson's related or not, that's definitely within the scopes of physical therapy. So.
Wonderful. I have one more question. This one's from me. I just kind of got curious. How do you see, is the progression really, really different from person to person? Are there kind of set patterns that people tend to progress, or is it really just quite different from person to person and how they progress in their Parkinson's?
So progression is different from person to person because everybody's symptoms are going to be different, but progression in general, if you're able to start early, that progression is much slower, which is great if we're able to diagnose early and get into therapy and start with those movements, strengthening and whatnot. But the less activity and the less, therapy or any sort of just getting up and moving that we're doing, the quicker progression is. So it really is different from person to person.
There is variations with people that have like the early onset Parkinson's that may be diagnosed in their 30s or 40s. That can be pretty quick, and can progress a little bit more quickly just because of the time of diagnosis and how early
Yeah.
symptoms started showing. It tends to be a little bit more aggressive. I also have seen progressive changes between like a tremor dominant Parkinson's and a postural instability gait dominant person with Parkinson's. Those that tend to have more balance and gait issues tend to have a little bit more progression because they are more hesitant to move and they tend to stay more stationary.
That fear of falling.
Yeah, the fear of falling keeps them still, and when you're not moving, you're losing. So I have seen progression be a little bit more consistent with those patients.
Yeah, that's a good point.
Wonderful. Well, thank you, ladies. I did a couple last calls for questions, so I think that's all we have. Can you remind them where they can find you if they would like you to come get help from you?
Absolutely. So we are in Bridgeport, right off the Dixie Highway. You can come see us here. I'm Kelsey Bleshenski with Occupational Therapy.
And I'm Nicole Judson with Physical Therapy.
And please reach out if you have any additional questions. We would be more than happy to answer them. But thank you so much for tuning in today and listening.
So if you're not sure if physical therapy is right for you, we also do free 15-minute screenings. So that way you could just come in, ask some questions, and we could talk about how therapy might be helpful for you or if it's the right choice for you at this time. So that's just a free 15-minute, come in, meet us, talk,
Yeah.
see if you like us. We're enjoyable ladies.
And Nicole does a great job of, we do a great job of communicating. And if she has a screening or a referral, if you're referred to PT and, she'll kind of say, hey, I think maybe you should start seeing, our occupational therapist as well. And we can then send out to your doctor and say, hey, they need OT too. So come see us for that. And so then you can kind of get both services if that's necessary for you and really work on that.
Yeah.
That whole body.
And generally just a little bit more about physical therapy and occupational therapy. When we schedule our Parkinson's patients, we like to schedule them same day and back to back.
Yeah.
So, you're looking at 2 45-minute sessions. You're here for an hour and a half. Kelsey and I really complement each other. I, work on the big physical movements, but Kelsey does the cognitive screen, and we kind of talk about what I can work into my treatment to make her session go better. And she kind of does the same with me. If I'm like, Kelsey, stop letting them use their hands to stand up, she will really enforce that into you to make sure you're building up your leg strength. So like we said, we work as a team.
And that's the benefit of having a team, kind of treating you holistically, as we're really right there with you. We're staying in contact, making sure that we are doing the absolute most that we can, to make sure that you continue to improve. So,
yep.
Awesome. Great work, ladies. Thank you again so much for sharing this. Thank you to everybody who joined us and asked questions. And just a quick reminder too, everybody who registered today is going to receive a follow-up email that has contact information for Kelsey and Nicole, and then also just kind of a wrap up of the webinar and a recording if you want to watch it again. So thanks again, everybody. And thank you guys for putting this on for us.